Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 039. A 45-year-old man with thrombophlebitis of the deep veins in his legs suddenly after physical exertion developed sharp pain in his thorax on the right, dyspnea, and hemoptysis. Objectively his condition is severe. He presents with acrocyanosis, shortening of pulmonary percussion sound on the right, and weakened respiration. Respiration is 30 per minute. Blood pressure is 110/80ths of a millimeter. Hg ECG shows sinus tachycardia. His heart rate is 120 per minute. The electrical axis of the heart deviates to the right. See key. What is the most likely diagnosis? A. Community-acquired right-sided pneumonia. B. Cancer of the right lung. C. Pulmonary embolism. D. Right-sided exudative pleurisy. E. Spontaneous pneumothorax. Thrombophlebitis is an inflammatory process that causes a blood clot to form and block one or more veins, usually in the legs. Types by location of affected vein. Superficial thrombophlebitis. Near the surface of the skin. Deep vein thrombosis, deep within a muscle. Pulmonary embolism occurs when a blood clot gets stuck in an artery in the lung, blocking blood flow to part of the lung. Blood clots most often start in the legs and travel up through the right side of the heart and into the lungs. Deep vein thrombosis. Symptoms of pulmonary embolism: shortness of breath, chest pain, cough, arrhythmia, lightheadedness or dizziness, hyperhidrosis, excessive sweating, fever, leg pain or swelling, or both, usually in the calf caused by a deep vein thrombosis, cyanosis. ECG finding in pulmonary embolism: sinus tachycardia, most common. S1Q3T3, pattern of acute cor pulmonale, McGinn-White sign, classic, about 10% of the incidence. A large S wave in lead I, A Q wave in lead E, and an inverted T wave in lead E together indicate acute right heart strain. Cor pulmonale is the right-sided heart failure, caused by long-term high blood pressure in the arteries of the lung, pulmonary hypertension, and right ventricle of the heart. Right axis deviation occurs when the QRS axis is shifted between 90 and 180 degrees. Symptoms: lung disease, right-sided heart strain, right bundle branch block, right ventricular hypertrophy. The answer is C. Pulmonary embolism.